before us the Health Department. And with the Health Department on our panel, we have Dr. Bill Paul, the Director, Mr. Stan Romine, the Director of Finance and Administration, and Ms. Diane Harding, the Finance Manager. Before you start your presentation, Dr. Paul, are you satisfied with the Mayor's proposal for your department?
The Health Department will continue to serve our customers and manage whatever public health investment you make in ways that will have the greatest positive impact on Nashville's health.
Thank you very much. You may continue.
Good afternoon. Thanks for being here. The mission of your health department is to protect and improve health and well-being for everyone in Nashville. We are working every day all across the community to ensure conditions where people can be safe and healthy. We're very excited. This year, we're preparing to move into our new headquarters a little over a year from now. Also, as an organization, we are rebuilding and revitalizing as we prepare not just for that move, but also for public health accreditation in the next couple of years. We do a lot of different things in the health department, but what we do saves money and it saves lives. One very visible example this last year was our response to the outbreak of meningitis, fungal meningitis caused by the steroid injections. We were very involved in that, in the tracking and follow-up of individuals affected by that outbreak. And once people were notified and brought to care, the death rate from that particular outbreak went down significantly. So it's a good example of public health saving lives. There are others. What we do is also important to Nashville's priorities. We know that children's health directly and significantly impacts school performance. Also, the health of our workforce drives healthcare costs and impacts Nashville's competitive edge. And right now, Nashville's not quite as healthy as it should be. The health department budget is about $45 million, and the locally funded portion is about $19 million. Within the local budget, several programs are partially or fully supported by fees. So local taxes cover about $16 million, or about a third of our funding. The Board of Health submitted a budget that included a 2% cut as requested, restoration of 3 animal control positions we've lost in recent years. This is paid for by a license fee increase of $2. That's from $4 to $6. It also included restoration of 3 additional positions to address strategic department needs. The budget in front of you includes just the 2% cut and the 3 animal control positions paid for by the proposed fee increase. This represents a net 1.1% cut in local support. It's about the 6th straight year we've been talking about cuts. And over the last 6 budgets, about 85 positions, about 30% of our locally funded workforce have been cut, and the local investment in public health protection has been reduced by about 20%. We will continue to provide great service to our customers and manage the public health investment that you do make in ways that have the greatest positive impact on Nashville's health. I'm happy to answer any questions you might have.
All right, Councilman Stein.
Thank you, Dr. Paul and your staff. You do good work, and personally enjoy working with you on a variety of things. With the animal control positions, that gets us to a place where we are staffed the way we want to be there?
It gets us to basically to the levels of staffing we had in 2007, and I think that'll be a very good position for us to be in.
It's particularly timely. We got an email today about an incident in Councilman Matthews' district that I think so. So that we, well, that's a good thing. I assume that increase in fee has to come before us? It's tracking with the budget. Thank you. I also want to ask, I also want to say that you gave perhaps the most politic answer of the season to the chair's question about your budget, and I want to commend you for that. And ask you, I know that many of the good things you've been doing have been grant dependent, and I know that obviously the federal government is a precarious thing. And this is, obviously you're surviving this budget with it. Are there clouds on the horizon because of the precariousness of some of that funding for some of the things? Obviously Nash Vitality is going forward, but wasn't that at one point pretty heavily grant funded?
The National Vitality brand was created in the Communities Putting Prevention to Work grant. That was a 2-year, extended to about 2.5-year stimulus grant. That grant's now over. So it was a stimulus grant. It helped us through the economic recession. We actually moved some local positions onto that grant, which allowed us to take a bigger local cut. We've gotten a little bit of that back locally, but that's all gone now. What did help us out on the end of the CPPW grant was a fatherhood grant. That's obviously in a completely different domain, but it did allow for us to shift some people over without laying them off.
So as we have continuously made cuts in the health department, as we have in most of the government over the last few years, does the grant, precariousness of some of the grant money, put you all at even greater risk as we move forward?
Well, I think it kind of changes our business model. We're more than half grant funded now. Some of it's pretty stable grant funding. I mean, WIC is a big and pretty steady source of grant funding for what we do. Other things are a little bit more episodic. So we knew that we had a stimulus grant. We knew it wasn't going to be with us forever. So as an organization, we have to be able to take these opportunities and turn them into great value for Nashville, knowing that they're not going to last for a long time. But I think that also means that we really need to have an operation that can support grants, developing grants and grants coming and going.
Thank you. You got a big bang for the buck with the Nash Vitality. I mean, I think it's really energized this community in a lot of ways. So congratulations to you all for that and for all the good work you do.
Thank you.
Thank you, Councilman Stein. Councilman Hunt.
Thank you, Mr. Chairman. Dr. Paul, it's good to see you too. But let me ask you this. I noticed that we had about a 33-person increase on your total budget positions. It's 33 more for the 13-14 year. The previous year was 463. This is 496. Is that a reason for that? Are you getting ready for your new digs and new building? What's the cause of that, and how is that going to shake out?
It would be grants. Yes.
We added back the Healthy Start grant that's taken out last year.
All right. As of the last budget cycle, the major changes there were that we did negotiate with the schools to get additional school nurses. So there's an increase in the number of school nurses in that number. Also, the Healthy Start grant, which is a state child abuse prevention grant, was not in the budget. It's always been sort of on the chopping block, and it basically came back. So it was not there at this time last year, and it is there at this time this year.
Yeah, so it's basically state grants, is that right?
Yes, state grant, and actually school nurses are funded by the state as well.
So that's almost going to be like a year-by-year thing because you don't know whether or not you're going to be funded.
You will see ups and downs in our head count, our FTE count, based on the grants, because those are a little bit more opportunistic and they come and go.
Kind of keep you guessing, don't it?
Yeah.
Thank you very much.
Thank you, Councilman Hunt. Councilman Davis. Davis.
Thank you, Chair. Thank you, Dr. Paul. Appreciate the presentation and keeping the budget lean again this year. Just one quick question. You had mentioned the Affordable Care Act in the strategic issues. I'm just curious, what is our role as that rolls out in 2014? What do you feel like the health department has in that, and why you guys listed it in the strategic issues?
There's basically 3 ways in which the Affordable Care Act can impact public health. I mean, obviously, we're interested in health and well-being for everybody in Nashville. The most obvious thing is if people can't get insurance, can't get care, they may have problems that they could get if they do. So there's issues with the Affordable Care Act of navigating, finding your way through the new system, that sort of thing. We don't have a direct role, but many of our partners do, and we have an interest in making sure that works well. Second, as Affordable Care Act goes on, it impacts some of our operations. Some of our operations are little, like immunizations, often thought of as a safety net issue, but really should be in the primary care that people are getting. So our work with the medical care establishment as there's more money available to serve primary care needs of folks. The third is that one of the aims of the Affordable Care Act is better population health. That is not just more medical services for people, but actually at the end of the day, getting people healthier. So in a lot of places, there's been opportunities to grab opportunities to link public health with medical care in a way that improves population health. You can think about asthma, where asthma is obviously a medical issue that you need to go to the doctor about, but it's also an issue about the environment in your home and the environment in your school and those kind of things. So those are opportunities that many health departments will be able to take advantage of and move towards better population health.
But so, yeah, which is all sounds great. So a really practical thing though is, someone may get that shot. They're going to be able to go to the doctor now, go to just their general physician, get, an immunization, like you said, and then they wouldn't have to go to you guys for that like they did before, or lean on you as much maybe. Right. I mean, I'm sure plenty of people will still, but.
So how that all gets paid for is we have to pay attention to how that all gets paid for. In our community, people lean on us a lot for shots.
Sure.
The pediatricians, many pediatricians don't even do shots anymore. They send patients to us. And so figuring out how that fits, how affordable care fits into our community, many health departments are getting better at billing all the payers so that the stuff can get paid for.
Mm-hmm. Great. Just finally, we've been hearing a lot about the animal control stuff lately, and I guess every year that's an issue. Councilman Stein mentioned the two positions. I mean, how do you feel the state of animal control is and just, staff performance, and do you feel like with that we're in good shape, or I guess any other general comments on?
Well, it's kind of like a lot of this stuff. If Nashville as a community wants to invest more, we can deliver more. I mean, I think our basic concern here is public safety, and so what we really look at is our response times. We want to see animal bites go down, and I think that the team works very hard, and they do a good job, and that job has gotten better. We've added technology, we've added more accountability, but it's a thin staff, and it's a pretty high burnout situation, and we have a significant amount of turnover. And so I think part of getting 3 new field officers is that this staff is covering all of Nashville 24/7, and we need some, a little bit of a bench so we don't burn out everybody that we've got out there. So I feel good about the team. I feel like there's obviously some new strategies that we're starting now that could serve to do things that people in the community care about. We don't really enjoy euthanizing animals. And so adopting more animals, we're taking several steps now to increase the number that go out the door adopted. But we also know that we're going to need to go upstream, and that is really working on spay and neuter and making more animals in Nashville spayed and neutered. And so we're going to be involved in that, but that's going to take more than just the health department to get that done.
Sure. Yeah, prevention, education, and I'll offer us as neighborhood captains, council members, that we'd love to help in that, and so please keep us informed as we're starting campaigns for that. And I'll just say I appreciate the responsiveness I've gotten when we have had a few animal issues here and there. So thank you for that, and keep up the good work, and I appreciate it, Chair.
Thank you, Councilman Davis, and Councilman Pridemore said that you're going to be the captain in his district too.
Okay, great.
Councilman Tiger.
Dr. Paul, the bike rental program, do you all administer that?
Nashville B-Cycle was purchased with CPPW, the stimulus grant, Communities Putting Prevention to Work. It was really developed and designed by the health department and pretty much handed over in a contract to the Downtown Partnership. So it is now managed by the Downtown Partnership.
Okay. I was just wondering if it required a subsidy, but that's a question for the Downtown Partnership, I guess, at this stage.
Yes.
Councilman Pardue was a huge advocate of riding bikes and healthier exercise, so I was asking that on his behalf.
Okay.
The backyard chickens, are you satisfied that the enforcement personnel, what issues are arising as that issue looms on the horizon? Does the permit fee cover the cost of the operation of that program? Those are my general questions concerning that.
The particulars of that, I do have. We've had a total of 206 permits issued at $25 a permit. And then we do get complaints, and obviously a public safety complaint's going to generally be a higher priority for us than a chicken complaint, but I have not heard a lot of issues about us not being responsive. So it has not turned into a big problem for us. We're managing it.
Could you provide us a list of the number of complaints by district and the general nature of those complaints? I think that would be helpful as we revisit this bill and decide what direction to go in the future.
Yes, absolutely.
And if you have any recommendations, for instance, 206 permits at $25 doesn't generate a whole heck of a lot of income for enforcement, or I've been down there for a chicken permit, and it requires some manpower and paperwork and bureaucracy. And I'm not advocating that I pay more for our school permit, but once again, I don't think the other people that don't have chickens should be subsidizing me. So.
Mm-hmm. Right. We'll look at that in terms of the fee covering the cost of the actual service.
And if there are other recommendations, for instance, one of the concerns I had originally was no standards for the coops, and I think that ought to be part of our future bill. So if you all have any recommendations on that end based on your complaints and field inspections or any of those type of things, I'd like to hear that too.
Sure.
Thank you, Councilman Tiger. Councilman Pridemore.
Thank you, Mr. Chairman. Thank you, Dr. Paul. Just recently, you just changed your adoption policy on, I can't remember the official term, aggressive dogs or certain breeds. Which I'm appreciative of that. How have you figured out how that's going to affect your budget as far as, because one of the first comments made after that policy was announced that there's going to be overcrowding in your facility. Have you come to some financial amount that may cost in the next year?
I don't. I mean, our facility does have limited space. The things that we've been working on at the same time. I mean, one of the so just for everybody's information, if you haven't heard, we did have a practice of not adopting out pit bulls. And we've basically, the reason for that practice really was a public safety reason, but I think also there was concern in the past that maybe people were taking pit bulls from animal control and using them in fighting. Well, really the best standard, the industry standard for adoption is not to look at an animal and see if it looks like a pit bull. Pit bulls as a breed are not necessarily the most aggressive, and we will have aggressive animals that are not pit bulls. So there's a temperament testing, a standard temperament testing, and we're having all of our staff certified and giving that. So one cost will be that this intense testing is going to be going on for pretty much every dog that's going to be adopted. So the concern is that we'll have a lot more animals moving forward to adoption, and that will cause crowding. I think we're going to take it a step at a time. One of the other things that we've been working on is some partnership agreements with rescues. So that if we're really full, that rescues can obtain animals at a discounted rate, or we just get animals out the door. The other is that we've had a practice of keeping animals in adoption for 2 weeks. We may end up needing to shorten that in terms of keeping an animal in adoption a shorter period of time and then trying to find another place for it. So one of the things, as we look at this, we have to look at this as a community, right? It's not just about that one facility there. We are working closely with Nashville Humane. We're also, work with other partners to try and get animals out the door so that we're not overcrowded and that we can still accept animals. So I don't know for sure,
Okay.
But we're going to take it a step at a time.
Well, it's not even been fully implemented, has it not? I mean, you've still
No, not yet.
Okay. I just wanted to see if there's some sort of figure, because if start getting calls about the dog issue again, concerning pit bulls, that will have some monetary figure to explain to them, what the cost is and that sort of thing.
Yeah, I mean, doing everything that everybody wants does cost money.
Right. Thank you.
Thank you, Councilman Pridemore. Council Lady Weiner.
Thank you, Chair. Thank you, Dr. Paul. I want you to please speak to the issue of grant writing, because you're so heavily dependent on grant writing. Who does the grant writing in the department? Do you have enough grant writers? And what kind of return on investment would you see if we were able to enhance that core of folks?
We rely on grants pretty heavily. Some of our big opportunities that we're most excited about for Nashville were CPPW, Communities Putting Prevention to Work. These are typically very intense grant writing exercises. You bring in whatever partners from around the community you can get together, but ultimately it ends up being senior staff from the health department writing it mostly off hours, evenings and weekends, and it's crunch time to get one of these in. We were successful with CPPW. We were not successful with the follow-on, which would be the community transformation grants. We were successful with the fatherhood grant, which we're excited that that's a great resource for Nashville. But it's been a little bit hit and miss, and we don't have one resource that's a grant writer. It is one of the things that we had asked for in the budget. As we look at our budget, a potential source of revenue, because there are literally millions of dollars in grant opportunities that we have either not even gone for, or we've gone for and we haven't been competitive. But I think we're strong enough that we could be more competitive if we had that dedicated resource.
So it would take one person, two people, a core of people to enhance your grant writing abilities?
I think at this point, we're going to try and find a way to fund a grant coordinator, grant writer who's our own person that can help with that whole process.
Based on your current budget?
Well, I guess that'll have to be that way.
Thank you.
Thank you, Council Lady. Councilman Claiborne.
Thank you, Mr. Chair. And Dr. Paul, I wanted to follow up on the question that Councilman Davis asked about the state of animal control. I was invited by Dr. Paul shortly after he came to his position to serve along with Council Lady Bennett on the advisory committee for MAC. And during the period of time that I've been there, animal control has made some significant progress forward. Officer Biggs has done a great deal in working to enhance the role of the dog catcher to an officer, make that more professional in its status. Dr. Paul has been very engaged with the committee and with his staff to do things to improve the function of the animal control facility, and continues to do so. And some of the things that he's alluded to in comments to past couple of questions have the potential to move us significantly forward from where we are in a much greater position to be able to handle dogs that are picked up and move them onto other ownerships or other environments so that they don't wind up being euthanized. So we're not certainly haven't arrived at where an animal control facility should be, but we are certainly moving forward. And so I just want to toot the horn a little louder than you did and let the folks that are here know that animal control is doing well and moving ahead.
Thank you, Councilman Claiborne, and we really appreciate your support on the advisory committee and your leadership in changing the boarding fee, which has given us a little bit of extra funds that we're really seeking to put into better outcomes in our community. Overall, I just want to blow our horn a little bit here, is because of, even though in the resource constrained situation we've been in, this last couple years we partnered with Nashville Humane. They've been doing thousands of spay and neuters out in the county, especially in high risk areas. These are for people who don't have a regular veterinarian and can't afford a regular veterinarian. We think it's partly because of that, but our total number of complaints and requests of service has gone down. Our total number of intakes at the animal control facility has gone from 13,000 to about 10,000. And our total euthanasia is trending downward. We'd like to see those things trend downward more quickly. And we still have more than enough work to do. But I think that, these are things that can change over time if we do things right.
Thank you, Councilman Claiborne. Dr. Paul, Councilman Banks.
Dr. Paul, how are you doing? Quick question on Nashville Vitality. Did I understand you when you said that it is expired this year, no longer a grant that you all have to?
Well, as a grant, correct.
Okay.
We hope as a movement that Nashville still embraces the notion of healthy eating, active living, and that as a brand, Nashville Vitality can still be a useful thing for Nashville. And as a department, we got a lot less to work with, but we want to support that as well. And it's really important to us to support the mayor's initiatives on getting people out, getting people active. The mayor's leadership in terms of really investing in a healthier infrastructure with open space and greenways and sidewalks is phenomenal. But yeah, we're just going to do the best we can to try and keep all the dots connected and keep people moving because I think there's still a long way to go before we've succeeded in turning the curve on obesity in Nashville.
And I was looking at that in the strategic issues. The $147 billion number is national, is that right? That's 3 Warren Buffetts. I didn't think that would be a number that would be the cost here.
Yeah, that's a national number.
Okay.
Different people will have different estimates, some more than that.
Any sense of what the healthcare costs from obesity are here for Nashville?
I don't carry it around with me. I'd have to sort of search
No
for
sweat,
that.
no sweat. Well, I was just curious to make sure that number was national.
It's significant.
How does obesity right now affect you all as a department in terms of operating costs? Is there any way to quantify that?
In terms of operating costs, I think obesity is something that the health department acting alone is never going to solve.
Right.
We will put whatever resources we can into our community's effort to turn the tide on obesity, and part of what we need to do is have data, have an awareness of what the best practices are, work to try and mobilize the best practices wherever they may be, whether it's in the schools or after school or adults or what have you in Nashville. And so we're working on that. It's hard to really put a budget on that. We've just probably got maybe one person who's spending the majority of their time on obesity prevention right now.
Okay. All right, thank you.
Thank you, Councilman Banks. There are no other council members in queue, but Council Lady Megan Berry did send some questions that I'm going to ask for her. If I could, Dr. Paul.
Yes.
It's a series of questions, and Miss Judy that works with Animal Control, her last name, could you pronounce it?
Ladeboucher.
It's a hard one to type too. Is she not here?
No, she wasn't able to attend today.
Okay, because some of the questions were directed at her. So I'll actually let Council Lady Berry forward those to her, but the ones that are not directed to her. And some of this has been covered by Councilman Davis and Councilman Claiborne spoke to it a little bit, but most of it has to do with animal control. How many animals did you take in last year?
Total intakes last year, 10,340.
And how many of those animals did you euthanize?
Our total euthanasia last year. Now this includes wildlife, dogs, cats. Some other cities you will only see dogs and cats. But our total euthanasia last year was 8,058.
Okay. And did you euthanize healthy animals even when the facility was not at capacity?
I don't have the answer to that.
Okay. Could you get that to us?
I can, yes.
All right. In an article in the city paper recently, you spoke about the importance of spay-neuter in the mayor's budget. In the mayor's budget hearing, you spoke about that. Is animal control taking advantage of spay-neuter funding stream created under the Tennessee Code?
Under the Tennessee Code, we're with MAC Advisory and basically working with partners. We're trying to mobilize whatever funding streams we can. Oftentimes, those funding streams aren't appropriate to local governments or operations of our size. That particular one, don't have details on whether we've looked at that particular one for Mac particularly, but I can look into that for you.
Okay, if you could. Could you walk us through the adoption process?
Well, I adopted my dog there. It's actually quite an inviting. You're talking from a consumer standpoint? Or from
Just the
animal
process.
standpoint?
There's some kind. I guess let me ask the follow-up question she
Okay.
has for that. So the adopter must fill out paperwork first before he or she finds an animal to adopt.
I think what I'm familiar with is you go and you can look at animals, and if you're interested in an animal, then you can fill out paperwork.
Okay.
You have to sign into the every guest signs in.
So if you adopt a dog, can you leave with the dog the same day?
If that dog has been spayed or neutered, yes, you can.
Okay. And I guess that answers the next question. The next questions are for Miss Judy, and I can't pronounce her last name. My apologies for that.
Miss Judy L.
There are several questions here at the end. Last year, an audit found discrepancies between inventory of controlled substances and their documented use. Were those discrepancies ever investigated?
Yes, they've been investigated, and new procedures have been put in place.
Okay. And in 2009, council members Bennett and Claiborne sponsored a bill that created a funding stream for animal welfare and education. How much money has that generated, and how has it been used to date?
This is the Education and Welfare Fund. Total amount that it's raised has been about $27,800. And the total expenditures have been about $15,000.
Do you know how that's been used?
$16,000. Most of what it's been spent on, frankly, so far have been educational things and things to give away to build awareness. Some of them little gifts for children when you go to a classroom and you're teaching them about being kind to animals, those kind of things. Where we are right now is really trying to investigate how to put this money to a more productive use in terms of enhancing community goals like spay neuter. So we're in a planning phase with how best to move forward with the funds at this time.
All right. Thank you. I'll have Councilor Berry forward her questions that were specifically for Ms. Judy. Thank you, Dr. Paul.
Thank you, Mr.
Councilman
Chairman.
Stein?
Just a quick question for the chair. The chair I have great respect for his attempt to accommodate us all. Can we all just send our questions to you and stay home and watch on TV?
If you want to, and I'll try to ask the questions in your voice and your personality,
Okay.
if you wish.
I think she may take exception.
Okay. Councilman Scott Davis.
Thank you, Mr. President. Dr. Paul, thank you for you and your staff for being here today. One thing as a suggestion that I would like for you to focus. Go ahead. All right. I thank you for getting rid of the kill rate for the pit bull puppies, and I know that you're working on a solution for the adult dogs. One thing I want to know in this budget, how are we going to start transitioning to a no-kill city? Because my constituents, and I know a lot of people in East Nashville are really concerned about that. And I think we have the potential as a city to become one of those cities that does not kill out dogs at all, because there's several cities that are wanting our dogs that are in the shelters, and there's cities that have no animals for adoption at all that are wanting and would pay for animals. Basically, I'm asking, can we work towards a comprehensive plan or set aside some money in the budget to work towards that? And also maybe doing a few changes on the MAC advisory board too to help address those concerns. And you could always email me. In full support, and thank you for the additional animal control officers, but this is a major concern that I think we need to start focusing on, as a city, personally.
Thank you, Councilman. Obviously, as a health and safety agency, our number one issue is always going to be safety. but we share the goal of getting as many animals out of the shelter alive as we can get out of there. And so we've been working for years with partners towards a community solution, and I think, it might be that we're reaching a turning point or a tipping point where we can accelerate that and get more animals spayed and neutered and increase the number of animals that are adopted and reduce our kill rate. Our kill rate, the euthanasia rate. Communities that have made a major public commitment have also made significant financial commitments, whether it's public or private. And so I think that is a conversation to have as a community. But I would say we're going to do everything we can to put the pieces together in our community to make progress on this.
Okay. How much of a financial commitment would you need to make this happen in a reasonable amount of time? Maybe over, and this is just a ballpark, this is nothing set in stone, over the next maybe 5 years, cutting the rate in half, and then after 5 years from then, over a 10-year period, just cutting it down to 0 kills?
That would be really kind of hard to estimate. We had some folks in here from Jacksonville last week, and they said increasing your spay and neuter rate for people who can't afford a veterinarian, increasing that to 6 per 1,000 residents per year was key. Working with Nashville Humane, we are at that right now, and we are seeing declines in our intake, but I know we can do better. So it's hard to really kind of put a number on it right now, but I think what we're going to do is get with partners and see how we can, double our spay-neuter rate and increase our adoption rate. Take things a step at a time and move as quick as we can.
Okay. As a request, within 6 months, could you have to me and some other members of the council what the financials look like to achieving this goal? Because I want to help.
Sure.
All right. Thank you, Dr. Paul. No other council members in queue. Your department budget hearing is closed. Thank you for your service to our city.
Thank you, Mr. Chair.